Hospice Kingston's vision is to join the existing community care programs and services with a residential hospice, which is really the missing element in our healthcare system in Kingston. At the moment, people have really two options. If they're able to stay at home with community supports, they can die at home. If they're not able to do so, then their only option is a hospital, and often an acute hospital, which is far more technically than what they require. And it's less family friendly often in terms of the environment because of the high tech. Hospitals are fabulous at what they do, but they're not the place for every person and for every circumstance. A residential hospice really fills that gap and provides an environment which is really high touch and really responsive to families with excellent care. Doesn't require high tech interventions. Excellent care, excellent medicine, but high touch, low tech. Our community has a tradition of working together, and particularly in healthcare. In our community, we provide not only excellent research, but excellent teaching for all the health professions, and that's not common. However, the responsibility for building a hospice belongs to the community because it's important, because it's the right time, and because it's the right thing to do. Residential hospice as a model of care, has a great reputation in supporting people not only through the act of dying, but in the bereavement and the grieving that follows. The time is now.
Hospice palliative care means different things to different people. In some level, hospice can be thought of as a building, a really great home-like setting for people to receive care at the end of their life. That's one thing that people think of when they think of hospice. In the broader sense, though, hospice palliative care is really an approach to care. It really addresses the spiritual, emotional, and physical needs of people who are approaching the end of their life. At the present time, there are 39 residential hospices in Ontario. The Ministry of Health and Long-Term Care has agreed to build 20 more residential hospices. Residential hospices are not new. There are hundreds nationally, there are thousands internationally. It is a well-established, well-respected, well-supported model of care. Patients and families that go to residential hospice like being in residential hospice. It's a home-like setting. It's the best thing that they can achieve next to being in their own home. It's not a sterile environment. It is not a hospital with bells and whistles and time frames that are not their own. It is meant to mimic home as much as possible. It is meant to give people that control back in their lives to have the life they wish to live for as long as they can. To say that residential hospice provides exemplary palliative care is probably the statement that I would like to make sure gets out there to the community. It is an incredible way to pass every day of your life well, fully, and with family and friends there to support you. The time is now for residential hospice. There isn't a reason why I can see we should not be having a residential hospice in a community that is well supported educationally, with resources, in a demographic that is aging, and in a community that really is well supported by the community.
My story happens to be a very personal one, and the reason behind my motivation to do this. Back a number of years ago, my mom was diagnosed with cancer, and she decided to take treatment, and after 2 or 3 months the treatment was not working, so we had a conversation as a family, and Mom's request was to stay at home and be comfortable and without pain. So that's what myself, my 2 brothers, and my dad worked hard to do, and we did that for a number of months. And then it was just getting to the point that it was becoming more and more stressful for my mom and for us to be able to provide that level of care and comfort. So what happened is that the palliative care doctor did a house call one morning and asked my mom how she was doing, and she wasn't doing well. So a decision was made to move Mom to St. Mary's of Lake at the palliative care, and off she went. And within 2 days, Mom had passed away. And great care, but just it is a hospital environment. And when I've had an opportunity now to visit residential hospices throughout our province, it would have been so much better, because I'm sure she was stressed about us, and would have been less stressful for us because we were not equipped to deal with healthcare issues, and we would have had those dialogues and conversations about when we were young and growing up and camping, and all those conversations you really don't get to have when you're trying to provide a level of care. We have so much good health care in our community, but the one part of it that we are missing is a residential hospice. And so my personal story is very motivating to me to have that happen. So the time is now for our community to build a residential hospice.
I think that our experience with the residential hospice is probably quite unique in that a hospice has been built and has been running since 2007 in Hamilton, the Dr. Bob Kemp Hospice, which was a dream and a hoped-for event of my dad, Dr. Bob Kemp, and his wife, Mildred Kemp, in the Stony Creek, Hamilton area, while my mother and dad were involved with a group of very committed citizens that brought this to be. Citizens that were really interested in their community and improving the health services of that community. So initially, it was about people that had no family to care for them. And then eventually, I think it became about people and families who needed support. Because it's one thing to say, I will look after my family member to the very end. And yet when you start doing the caring, the actual physical caring for that person on a 24-hour basis, often that becomes overwhelming for a family physically.
The time really is now for Kingston to get behind and build a hospital for the people of this community. And it would be beyond that, that there is an advantage to a community in having a hospice. It frees up active care beds in hospitals. Mm-hmm. It's a less expensive way to look after people that are living, that are at the end of their lives. And it is in a setting that allows more flexibility in terms of meeting the client's needs at the end of life that we have observed in many places. The Bob Kemp Hospice had a young woman in her 30s dying of cancer, and she wanted to, I have a hard time saying this, she wanted to die outside. And so they wheeled her chair out onto the patio at the back of the hospice, and with her children gathered around her, she died in an open outside space. And I just think that was a response to her need to be in nature when she died that was really valuable to that community and to that family.
I made my donation to the Time Is Now capital campaign in memory of Lydia, a friend who taught me more about grace and strength in death than I could ever learn through life. Lydia would have been 64 this year. She passed away 9 years ago. I just started going on Fridays to make that drive with her. And then very sadly, the fall of 2006, she was hospitalized. And her husband was hospitalized January of 2007, and he passed away in March of that year. She does have children. They're all out on the West Coast in a younger stage of their lives, and they were sort of coming back and forth. But at that point in her illness, she was really surrounded by sort of a small band of friends, and I was lucky enough to be one of those people. It's a question of how quickly can we do this. Cancer has just touched too many of our lives. Lydia would have definitely benefited from a residential hospice. She was hospitalized for a long period of time, upwards of 9 months. She was at both KGH and St. Mary's where she received incredible care. Lydia always wanted, even up until her last day, to be in a place that was more like a home. Join me in donating to the Time Is Now campaign.
The time is now to invest in our community, so please donate now.